Hello and welcome to this Cerner Millennium training video. This video has been created to show clinicians how to locate patients within the EPR, raise requests for patients, and document within the patient's record. You will locate the Cerner Millennium EPR by one of two methods. The first is on your computer desktop. The second is via the Trust's intranet OLI. To access via OLI, you will need to hover over the Quick Links header and select Cerner Clinical. We, however, will log in via the Cerner Clinical link on your desktop. Once on Cerner Works, you may notice a few different folders. To be clear, always select the production folder. This is sometimes displayed as P2085. Once in the production folder, I will select PowerChart. We are selecting to run PowerChart, as this is the application all clinicians will use to view records, request, and document. If a username and password is required, this will be your computer login details. If an error message appears, this might be because you do not have a Cerner account. You will need to request access to this via the IT self-service portal. Now I have logged into the system, I can search for my patient by using the search box in the top right corner of PowerChart. You will need to click on the magnifying glass to see the search engine. I can search by a few different fields, however I would prefer to search by the patient's MRN number. This will most likely be the patient's old RXR number. Once I press search, I will see the patient's name appearing in the top box of the search engine. You would ensure this is the correct patient, then decide which patient encounter you are wishing to view. I would recommend sorting these by encounters that don't have a discharge date. Then I would decide which is the relevant specialty. Once located, you would double-click on this relevant encounter. On most patients that you select, you will notice an accessible info alert appear. This is a legal mandatory for trusts to complete. In order to bypass this screen, you will need to select Access Info in the bottom left-hand corner. You will notice a yellow box appear. This needs to be completed, regardless of if you are completing the patient's accessible information. If the patient is not present or you need to access this record as a medical emergency, the system will allow you to defer by selecting one of these options and the green tick to sign. However, if you are in front of the patient, it is a legal requirement to complete. To do this, you will select No Override and select whether the patient has any accessibility needs. If you select No, it would just be a case of selecting the green tick to sign. If yes, select the relevant diagnosis. You will then notice the Reasonable Adjustments tab has an asterisk next to it. You will need to select this, then identify the reasonable adjustment, then select Sign. Once you have entered your patient's record, you will notice that the patient's details fall underneath a blue banner at the top of the screen. This blue banner contains a mix of demographic and clinical information. For example, beneath our patient's name, we can see that our patient has allergies. If I click where it says allergies, I can see what allergies my patient has. This same rule applies to flags and alerts for patients. By clicking on this, we can see the reasonable adjustment that was added in the previous screen. Next, CPE stands for Child Protection Services and will populate if the patient is known to this service. TDD stands for Target Discharge Date, and this is something the nurses will populate, estimating the day of discharge for the patient. Next, we have the age and date of birth of your patient. then whether your patient requires full resuscitation or DNR, and beneath that, whether your patient requires any isolation precautions. Next along will be the NHS number for your patient. In my case, this is a test patient that doesn't have an NHS number. Beneath that, the medical record number, referred to as the MRN, and next the sex of the patient. Then we have the patient's location and the overarching consultant for this patient. In between is the patient's encounter, which was mentioned on the previous screen. If you wish to change this encounter, this can be done by selecting the encounter you are currently on, then selecting the one you want to be on and select OK. Next, we will look at the large section beneath your patient's blue banner. These are your patient's M pages, also referred to as tabs. These tabs work in the same way any internet browser does, and they will differ depending on your role. For example, I am on Nurse View. However, you could be on Doctor View. These tabs can be closed using the X button, or you can select the plus button to add different tabs. A good example of a useful tab you may add is the Outpatient tab. If you are wanting to document for an outpatient, you will need to use this tab. Each tab has a list of useful components on the left-hand side. These components can be rearranged in whatever order you require. I would recommend dragging and dropping the Documents component higher in your list. Documents is an essential part of your patient's record. Within it, you will find all forms and notes that have been completed for your patient, regardless of what job role the person is completing that documentation. For example, a nurse would see doctor's notes and vice versa. Think of documents as the area in the EPR, which has replaced the physical documentation and forms. You can filter documents by date, or I could filter documents by just ones that I have created. To view a document, just select it to view. If you select Enable Continue Scrolling, it will allow you to scroll through all documentation. There are a number of useful components within the patient's record. You can remove components that you do not require. This is done by hovering over the hamburger button in the top right-hand corner of the screen and selecting it. You will then hover over where it says Components and untick any irrelevant fields. Some good examples of useful components are as follows. Presenting complaints. This will display what your patient has presented with. This can sometimes be pulled from the emergency department, as it will show what has been entered when the patient presents in ED, as this data is recorded in the triage form. Problem list. This will display your patient's diagnosis and also long-term chronic conditions. For example, our patient's current diagnosis is acute myocardial infarction. This will display as a this visit diagnosis. Long-term conditions, for example, asthma, this will display as a chronic problem. Clinical Summary is a free text box that is used as a complete overview of your patient's stay. This field will be one of the most important elements of the discharge letter. Unlike many other free text boxes, this is a shared free text box that all clinicians can add to, edit, and remove. Please note this field is not designed to have a complete history. For example, every detail of your patient's record. It is a concise overview of your patient's current stay. Vital signs will show your patient's vitals results. As an inpatient, this is recorded in Patient Track. As an outpatient, this is recorded directly into Cerner. Home medications. This will show what medications your patient is taking at home. Medication and medical devices component. This will display what your patient is prescribed in an acute setting. Next, we will look at how to place an order. We will be ordering an X-ray. However, ordering is not just limited to radiology. You can order referrals, medications, consultations, surgery, and more. The component used for this is called New Order Entry. Once located, you will search for the item that you are ordering. For radiology, most scans begin with the scan type first. For example, XR is what you will type in to search all X-rays, US for ultrasounds, or CT for CAT scans. We will order a chest X-ray. Once you have located the relevant order, you will single-click on this to add that item to your basket above. Here you can see my basket has one item in it, and this will be the chest X-ray. To be clear, another click on this item will remove it from your basket, so do not double-click on these items because it will add, then remove it, all in one go. You can also favorite items in New Order entry. This will not be displayed in this video. However, you will find videos and guides on this feature within the eCoach module within PowerChart, or by going to our YouTube channel, ELHT Cerner Training. Once you are happy with your order, you will select your basket, then modify details. This will take you to the Orders screen. Once here, you will see your order. The hospital icon on my order indicated this is an inpatient order. The blue circle with the white cross within it indicates that I still have mandatory fields to complete before I can sign this order. Once I select my order, those fields will appear in yellow boxes, ready for me to populate. I will now complete those fields. I have now completed my yellow mandatory fields. To complete the order and send to radiology, I will need to select the Sign button. In the bottom right-hand corner, this will automatically land you back onto your patient's M page. To see your new order, you can go to your patient's order profile component. I tend to put this component directly beneath new order entry for ease. We can see my chest X-ray appear. Most orders can be cancelled if a mistake was made when ordering. This rule applies to most orders, but not to radiology. I will find another order I have placed, select it within Order Profile, and select Cancel/DC. This stands for Cancel and Discontinue, effectively deleting my order. Cancel and Reorder will allow you to cancel the current order and place another all in one go. Once I have selected Cancel/DC, I will have a new order in my basket. This is the order to cancel. I will select my order, then modify details. To cancel some orders, you will need to select Reason for cancelling. Some will allow you to cancel without inputting a reason. We are now going to look at how to document within a patient's record. To do this, you will need to be on your patient's M pages, scroll down to the bottom of the component list, and click Select Other Note. You will now be taken to the Create Documentation screen. You will need to ensure that the Note Type List filter is set to All, because this will display all possible note types. In this example, I'm going to select Research and Development Progress Note. On the right-hand side of the screen will be all potential document templates. Some examples may be a Progress Note template or an S-bar handover note. We are going to use Free Text Note. To find this, you can type in the word Free in the top right corner. We are using Free Text Note because this note template is blank. We can input as little or as much information as is required. Double-click on the relevant template in order to type into it. I will just put in an update to say that the patient has opted into this research program. You can also use a feature called Auto Text within the field. Again, you will find information on Auto Text from eCoach or the YouTube channel. Once you have typed all the information required, you will select Sign/Submit in the bottom right-hand corner. One thing to remember, particularly when you are using the free text note template, you will need to update the title of your document. This is because the subject field within the Documents component will display the title. If the title is Free Text Note, this would not be a suitable description of the content. I will now complete the document by selecting Sign. To view your newly completed document, you will need to first refresh your screen. This is in the top right-hand corner of PowerChart. Once the screen refreshes, you will scroll down to Documents. and your newly created document will appear. To view it, single-click on that document. If you have made an error with this document, you have the option to modify. Once you select Modify, it will ask you to either revise or addend. Revise would allow you to replace incorrect data. Addend will allow you to add an additional note. Just remember to select Sign once updated. To log off the PowerChart application, use the exit icon on the third toolbar or click the X in the top right.